A lot of patients, when I draw a hairline for them, their first reaction is, "Oh, that's too low. It's going to look fake. I don't want a hairline that low." And I don't draw hairlines too low. I draw them in an appropriate shape and fashion for one's aging, future aging, degree of hair loss. I factor in a lot of things: ethnicity, gender, facial shape, many factors that go into a design of a hairline. But the one thing is that when it's seamlessly natural, people simply just don't recognize it as being done or being undertaken, or in other words, constructed. And so the reason to not do a hairline that is super high up, where you would think, hey, I don't want anyone to spot it, is that a hairline that's too high up fails to frame the face. And so framing the face means when you look at someone who has a very, very hairline to the point where they're actually thinning, you look up there and you think about the fact that he's actually thinning. But when you look at a person that has a strong hairline, your brain doesn't look at it, just looks at their face, and because it frames the face very well. So if you don't have the aesthetic frame to the face, you lose a large extent of the benefit of what a hairline reconstruction or a hair transplant is. So you want to be low enough that it actually frames the face. Now, there's one exception to this, is that there are gentlemen out there that simply don't have enough donor hair for me to actually adequately frame the face lower down. In those cases, I call it framing the head. So framing the head means that I can frame all the way from side to side, where when you look at the person, you have hair going all the way from one side of the scalp to the other. But it's not low enough that it's actually creating a strong visual frame. It still looks receded. And that conservative pattern is only done so that it mimics a Norwood pattern. In other words, a natural pattern that exists in nature, but still provides an adequate degree of coverage that the person, when you're looking at them, you can't see the baldness on the back of their scalp, which is still there. Today, if people are not getting a significant degree of reconstruction, oftentimes the younger individuals just prefer to shave their head and not create this framing the head treatment. I find that a lot of the people that are eligible for framing the head, in other words, a more conservative design, are usually over 50, sometimes mainly over 60. They've got a very small fringe, like a Norwood 7 pattern. They've got very advanced baldness where their lateral humps, or in other words, their outer portion of their scalp is dropping down. You can listen to my podcast on lateral humps, but they're starting to fall away, and they're not going to shave their head anyways. They just don't like the idea of shaving their head. They wear that horseshoe ring around the back of their head. They want some frontal coverage, but they don't have enough donor hair for me to adequately bring them forward to frame their face. In that case, in those situations, they look great with framing the head, where it's a much more conservative design that looks natural, that gives them, when they look in the mirror, they don't see baldness. There's hair going from side to side. So that's a quick summary of framing the face and framing the head for hair restoration.